So high blood pressure is considered the silent killer. The reason why we call it that is it doesn't cause any particular symptoms, so it begins to increase over time without people being aware of it. It's important to know what your blood pressure is because it contributes to heart disease. It can cause several different types of heart disease. One of the things that I spend most of my time taking care of are patients who have heart failure, and high blood pressure is probably the single most important contributor to the development of heart failure. Other things that high blood pressure can do is it can increase the risk of having a heart attack by accelerating atherosclerosis or hardening of the arteries. It also increases the risk of stroke, either an ischemic stroke where the brain doesn't get enough blood flow, or a hemorrhagic stroke where there's actual bleeding on the brain. So it's important to prevent all of these things by being able to control your blood pressure. So a normal blood pressure is 120 over 80, and many of you have probably heard that number before. We've talked about it over many, many years, but we've actually lowered the normal blood pressure range to that 120 over 80 number. So numbers that are higher than that, between 120 over to 130 on the top number, would be considered elevated blood pressure. And then once you get above 130, you go into different stages of high blood pressure. So stage 1 would be 130 to 139. Stage 2 would be between 140 and 180. And anything over 180 is considered a hypertensive crisis. So one question I get asked all the time is, what causes high blood pressure? And it's not a simple answer. So sometimes high blood pressure occurs with aging. And if you look at people who have high blood pressure, oftentimes they're older persons. And that's because as we get older, our blood vessels get stiffer and they generate a higher blood pressure to maintain blood flow. Other things that can cause high blood pressure are dietary habits. One of the biggest one is sodium or salt. Quite simply, there's way too much salt in the American diet. We eat on average as Americans between 3 and 4 grams of salt a day. And really it should be about 2 grams or 2,000 milligrams of sodium a day is enough. When you begin to eat a lot of salt, your kidneys hang on to that salt. That increases your blood pressure. So adhering to a low salt diet can prevent the onset of high blood pressure. Other things that can cause high blood pressure: sedentary lifestyle, not getting out there, not exercising. And other things that can do it: smoking. Smoking is a big cause of high blood pressure. So don't smoke, get exercise, don't eat too much salt. So if you're told that you have high blood pressure, don't panic. What it means when you have high blood pressure is that your blood pressure exceeds that 120 over 80 number. So let me tell you a little bit about those numbers. So that is the pressure. 120, that top number, is called the systolic blood pressure. That's the amount of pressure that the heart generates to get blood out to the body. 80 is the lower number, or the diastolic blood pressure, and that's the amount of pressure within your blood vessels when the heart is not pumping. So the top number is systolic, the bottom number is diastolic. In general, as we get older, the systolic blood pressure tends to increase more than the diastolic blood pressure. And in fact, in some older persons, we call that systolic hypertension in older persons, which is that the systolic blood pressure has elevated quite a bit because of arterial stiffening. The good thing is that there are lots of things that we can do to get that blood pressure lower. So one of the ways to find out whether you have high blood pressure is to get your blood pressure checked. There are lots of different places where you can get a blood pressure checked. Obviously, seeing your doctor, they can check it in the office. But there are also a number of community events where you can have free blood pressure screenings to go in, have your blood pressure checked, and see if it's high or not. In fact, some community drugstores will have free blood pressure screening, so you can have your blood pressure checked to know whether or not you have high blood pressure. So it's good that you're concerned about your blood pressure, and it's important that everyone know what their blood pressure is. If you're concerned that your blood pressure is too high, we can provide some advice about how to get it down. So there's several things that you can do to get your blood pressure lower if your blood pressure is high. So one of the most important things is to not eat too much salt. So to limit your salt consumption or sodium consumption to less than 2 grams a day. And people often ask me, how do I know how much salt or how much sodium there is in foods? And the good thing is that all foods now have food labels. Even restaurants will post the amount of sodium content in foods. And a good number to keep in mind is 2,000. So you want to eat less than 2,000 milligrams of sodium or salt a day. Other things that you can do to lower your blood pressure, well, if you smoke, don't. Stop smoking. Smoking raises blood pressure in addition to causing a number of other health concerns. Be active. Get exercise. One of the best exercises is simply going out and walk. If you walk 30 minutes a day, I guarantee you your blood pressure will come down. And at that point, if you adjust to those lifestyle changes and your blood pressure still remains elevated, speak to your doctor or speak to your nurse practitioner. There are a number of medications that can help lower blood pressure in combination with lifestyle changes.